Hi, everybody. Thank you for joining this meeting today to discuss your newest health benefit with Kavira. Kavira is a membership-based primary and urgent care clinic that provides everyday medical care through both virtual visits and in-person house visits. This membership has already been paid for by your employer, and in turn, you and your family will receive free or almost free, unlimited access to the Kavira Care Clinic. A little later on, I'll go over when there may be some small fees associated with using Kavira, but ultimately our goal at Kavira is to make everyday care more affordable, accessible, and as convenient as possible for you and your families. The problem today with the traditional care system of going to the doctor's office for those everyday care needs is, simply put, is not a great system to begin with. And it really comes down to two main reasons as to why. The first reason being high costs, and the other reason being poor patient experience. Like most of us can probably relate to, it can get really expensive to go to the doctor's office, where patients are hit with surprise bills, high copays, and on the other side of things with poor patient experience, it can be really difficult to get an appointment scheduled in the first place. Taking days, if not weeks, to get that appointment on the books. And half the time, we need to take time out of our day, drive across town, and those appointments usually seem to run about 30 minutes late to begin with. And the data behind this is that 50% of us are struggling to access care due to inconveniences. And with the average American annual out-of-pocket spend on everyday care is over $600. So in turn, about a third of us are skipping care altogether due to costs. And now here's where Kavira comes in. For your day-to-day care needs, Kavira takes the digital front door approach, meaning every visit starts with you reaching out to us through our online or mobile app, and or through our clinic phone number where you could call or text us app. And through the app, we're able to diagnose, treat, and prescribe. There's no copays, there's no insurance hassles, and there's no surprise bills. We'd like to say it's almost like you have a provider on speed dial in your pocket at all times. Next, and here's the really unique part about Kavira, is that if and when in-person care is determined to be the best course of treatment, we'll actually send the provider to care for you in the living room or in the workplace. And in the living room, we could do just about anything you would receive at a traditional primary or urgent care clinic. So think rapid strep tests, rapid flu tests, blood draws, physicals, and we can even do x-rays. And like I mentioned at the beginning, Kavira is membership based, so there are a number of perks and a number of things that we do to go above and beyond for our members. I've already mentioned the in-home imaging. We also offer 30 free labs to our members, and we also have access to thousands of other heavily discounted labs if you ever need a lab that falls outside of that list of 30 free ones. And similarly, we have 300 free prescriptions available to you at no extra cost. But if a medication is ever needed that falls outside of that list of 300 free meds, we can get that sent to your local pharmacy for pickup. Now, really quickly, want to give you an example of how this would work. So imagine one day your child wakes up with a sore throat and a fever. You'd reach out to us through the app or through our clinic phone number. You would tell us what's going on, and we'd say it sounds like it's strep throat, but let us send a provider to come take a closer look to be sure. Our provider would then come and care for your child in the living room. In the living room, we'd administer a rapid strep test, and if they do have strep throat, we could have a prescription ordered right away. Now, the really unique part about Kavira is that we cover the entire family. So the employee, their spouse, and their children under the age of 26. So if your child does have strep throat or any other highly contagious illness, it's likely that you or someone else in the family has it as well, and you don't know it quite yet. Our provider could then administer additional rapid strep tests to you and other family members. And if someone else has strep throat, they could have a prescription written for at that same time. If you were to think of the alternative of having to wait a few days to feel symptoms, then take time out of work to drive to the doctor's office, you could really see very quickly how you're saving time and money with your Kavira membership. And then I mentioned almost free care. So for those that are on an HSA plan, there is a very small visit fee associated with non-preventive care. Now looking at our common services that we treat at Kavira, we treat a number of acute conditions or those everyday care needs. So really think of things that you would wake up with, like a sore throat, a fever, sinus infection, a rash, pink eye, and many more. But we can also manage mild to moderate chronic conditions by doing prescription refills, working with you on your annual or your quarterly blood work, and as well as a provider working with you to create an individualized wellness program. And then on the preventative side of things, we do annual wellness exams and sports physicals for children. And I've already mentioned the in-home non-emergency imaging. A use case for this would be to diagnose chest pneumonia or a light sprain. And want to highlight this bottom note here. For the most up-to-date services list, please view our site at www.kavirahealth.com/services. And then here's a list of those 30 free labs included in your membership. If you ever need a lab that falls outside of these 30, we have access to thousands of other heavily discounted labs. I would encourage you to take a look at our website, www.kavirahealth.com/labs and meds, for more information regarding our labs and medications, and then as how to gain access to them. And what we're most proud of at Kavira is that the service truly works. It's true when you remove copays, insurance hassles, and surprise bills, and provide great responsive care where it's actually convenient for you and your family. People truly do love the service. And at this time, we're seeing over 9 out of 10 ratings across all patient encounters. Now I want to spend a minute talking about what's included and what's not included in your Kavira membership. Up until this point, we've touched on mostly what is included with your membership. Every visit starts with you reaching out to us through our app or through our clinic phone number. And from there, we should be able to figure out the best way to treat you. But now here's what's not included as a part of Kavira. Care that can't wait more than 1 to 2 hours is going to fall outside of what Kavira is able to offer. If you describe emergency symptoms to our team, they're likely going to direct you to urgent care or the emergency room. We also don't provide specialty care like dermatology or orthopedics, so it's important to keep your specialists in place for items like that. And our team does not administer vaccines nor prescribe controlled substances, nor do we refill controlled substances, and we don't do pelvic exams, pelvic physicals, or mammograms. We are not a full replacement for pediatric care. We can see children 6 months and older. It's important to keep a pediatrician in place for items such as vision checks, immunizations, and just wellness exams. And as to our clinic hours, Kavira is available both virtually and for house visits weekdays from 8 a.m. to 7 p.m. And then on weekends, we are virtual care only from 10 a.m. to 2 p.m. Now here are some of our most frequently asked questions we receive. If you do have additional questions after this discussion, please reach out to your HR team and we can get those, get them connected to our Kavira team to make sure all questions are addressed. First question being, who are my providers? We have a team of board certified registered nurses, physician assistants, and nurse practitioners who all have specialties in family medicine. One thing I like to brag about that all of our clinicians and providers are W-2 Kavira employees. The benefit being to the members that our providers can really get to know them and their medical history, and time again, they can request them for managing their chronic conditions. But as to who in my family can use Kavira, I mentioned this once or twice already, but the employee, their spouse, and any dependents/children under the age of 26. And if you don't have a smartphone, not a problem. We have a clinic phone number you can call or text us at 763-373-3856. And then prior to your start date, we'll be sending brochures via mail, email, and text outreach to set up welcome calls with our providers, give you information on how to download our patient communications app. So keep an eye out for all of those. Ultimately, that's all I have for today. We look forward to taking care of you and connecting with you. And if there's any questions, please reach out to HR and we can get those answered for you. Thank you.